Hi guys. So in this video we're going to talk about Crohn's disease. So basically one of my friends has been suffering from Crohn's, but I didn't know about it for a very long time because his treatment was working really fine. But for the past 1 year he's suffering because his biologics are not as effective and he's switching from one to the other, and he's been losing a lot of weight and falling really sick. So I thought I'll make a video on Crohn's. So what I did is I spent a week researching about Crohn's disease. So I watched 3 1-hour lectures on Crohn's, where one whole hour I researched about the diet when you are having Crohn's or ulcerative colitis, all the emerging new therapies and the old therapies discussed by all these doctors belonging to UCLA college, and this lecture by this professor explaining what is Crohn's and how it affects us, all the symptoms, treatments and complications, surgeries and everything. So, if you are a layman like me and you don't understand the terms like duodenum, jejunum, like the anatomical parts, or the medicines like Infliximab, Ustekinumab, or the complications like strictures, fistulas, then I've got you covered, because the whole aim of this video is to reduce the gap between a specialist doctor and a layman patient. So, basically, convert all the doctor jargon, biological terms into simple English so that you as a patient will gain more control over your own disease. So the hope is at the end of this video, you as a patient are not afraid of Crohn's disease anymore, but you feel empowered to take on the fight and the challenge of Crohn's disease. So let's start with the video. Crohn's disease is basically an inflammatory bowel disease, and the best way to explain this is by using Trump. If you remember back in those days when we were having Corona and COVID and we were having lockdowns, Trump was basically advising everyone to drink bleach as a way of fighting COVID. Back then, everybody laughed at his idea, but if you look really closely, then bleach is actually an excellent idea for killing Corona. But the problem is, along with Corona, bleach also kills your own body. It burns away your intestines. Well, in Crohn's disease, this is exactly the problem. There is some pathogen, trigger, irritant, or foreign object, but we don't know what. So I just put a black dot here. For some reason, the body treats this as the enemy, and so to kill the enemy, our immune system goes to war with it by creating an inflammation, which is basically Trump's bleach. So what does the bleach do? Along with the pathogen, the foreign object, it is also killing and destroying your own body. So inflammation is nothing but our own body's bleach, where in trying to kill the pathogen, the bleach is also destroying our own body, which is why Crohn's disease is called inflammatory bowel disease, where bowel refers to your intestine. So small bowel means small intestine, the section in the middle, and large bowel means large intestine, this huge thing that surrounds it. But Crohn's disease is not just limited to the bowel, can actually happen anywhere in the whole digestive tract. So from mouth to anus, Crohn's disease can happen anywhere along this digestive tract. So why is it called bowel disease then? Well, basically 60 to 70% of the people, meaning majority of the people, find Crohn's disease affecting only their intestines, the bowel. Therefore, it's called inflammatory bowel disease. But the rest 20-30% also find symptoms in your mouth and anus and everywhere else, even the esophagus and the stomach. So if you take 100 Crohn's disease patients, so these are all patients, then 30% of them might see it only in the small intestine and nowhere else. 30% might see it only in the large intestine, the colon, and nowhere else. Some 10% might see it both small intestine and large intestine, and the rest can see in all other places too. So if you take any two Crohn's patients, the symptoms and problems that these two people are facing will be wildly different. So if you follow patient stories on YouTube, say a small child or a lady or a grown man, then all of their stories will be very, very different, because Crohn's disease is very, very individualized, which is why the disease is also very complex to understand. So if you are suffering from Crohn's, then I would request you to check out Crohn's Colitis community online, where you can go to this community forum, check the symptoms and listen to stories from different people with different kinds of symptoms. So here you have mouth ulcers, right? So check that website and find your own sub community within the larger community that is suffering from inflammatory bowel disease. So there are two diseases that falls under inflammatory bowel disease. One is Crohn's and the other is ulcerative colitis. So the short form for these two diseases is IBD, inflammatory bowel disease. But there is also another disease called IBS, which is irritable bowel syndrome. So Crohn's and ulcerative colitis fall under IBD, And then there is another disease called IBS, irritable bowel syndrome. So what are the differences between these three diseases? And how do you diagnose which one you are? Well, in both Crohn's and ulcerative colitis, your bowel is actually damaged by the disease. So in colonoscopy, if you actually take a camera and go into your intestines, then you will actually find wounds and injuries to your intestines. But in irritable bowel syndrome, it is just a syndrome, meaning you get all these symptoms just like Crohn's and ulcerative colitis, but actually when you go inside the intestines with a camera or a scope, then you will find no damage in the intestines. So a colonoscopy is the best way to identify whether you have a syndrome or the actual disease, to see if your intestines are healthy or actually damaged. And between Crohn's and ulcerative colitis, to identify which one you have, we need to look at the pattern of damage. So if this is your large intestine and say this is your small intestine, then ulcerative colitis starts from the end and slowly progresses up along the colon. So 1 month in, you'll find only this part damaged, 2 months in, this much is damaged, 3 months in, this much is damaged, and slowly the damage climbs up the colon all the way to the start. This is ulcerative colitis, where the disease affects only the colon, gradually climbs up the colon, and the damage is continuous. What do I mean by continuous? Well, in Crohn's disease, the damage is random, meaning here you will see a damage, here you will see a damage, here, here, here. The damage is spread across the intestines and it takes random spots in your intestines and creates a wound in those places. And second difference is Crohn's disease is not limited to the colon, but it can happen anywhere. From mouth to anus, anywhere the damage can happen. So just by taking a colonoscopy, by looking inside with the camera, you can identify whether you have Crohn's disease or ulcerative colitis. And if there is no damage, but still you're getting the symptoms of these diseases, then you have irritable bowel syndrome. So these are the three diseases and this is how you differentiate between them. And colonoscopy is how you determine which disease you have. But if we go back to inflammatory bowel disease, and if we replace bowel by lungs, then you get asthma. If you replace bowel by joints, inflammatory joint disease, then your disease is called arthritis. So basically arthritis, asthma, Crohn's disease, all these inflammatory diseases, the body is basically fighting against some unknown pathogen or irritant or foreign object, and in trying to kill that, the immune system creates a severe intense inflammation which becomes like Trump's bleach, where in trying to destroy this enemy, the bleach also ends up destroying our own body. So let's try to understand inflammation. So anytime you get an injury, say an internal injury or an external injury, say you got a cut in your hand, external injury, then blood rushes to this place, lot of blood rushes to this place in order to do two jobs. One, stop the bleeding and heal the wound. Two, kill any viruses or germs that entered your wound. So the immune system in your blood takes care of the killing part, while other things in your blood, say vitamin K and stuff, takes care of the healing part. So some components of the blood takes care of the healing and some components of the blood takes care of the killing. But for both to happen, you need a lot of blood going to that region. And when a lot of blood comes to this region gets swelled. And if you touch it, it will be a little warmer than other places in your body because there is a lot of blood going there. So this increase in blood is what we call inflammation. Why? Because it feels like there is a flame inside that is warming this place up. So inflammation, flame inside. So anytime you hear this big word called inflammation, just replace that with increased blood, and the blood is always trying to either kill using the immune system or heal using vitamin K and other things. I'm not some doctor, so bear with me. And usually this happens in a sequence. So the killing happens first and the healing happens second. So only when the immune system finishes its killing process and quiets down, does the healing process start in the blood. So if the immune system never quiets down, it is always on full fight mode, then the healing never happens. And the immune system, when it gets too strong, it starts to kill everything, including our own body. So the same blood that's supposed to heal us can start to kill us if the immune system doesn't shut up its mouth, which is what happens in Crohn's disease. If you take the digestive system in Crohn's disease, especially all this curly stuff, then the whole digestive system can be treated as one single pipe. So instead of a complicated digestive system that just curls and then ends at the anus, you can just replace all of this with just one single pipe. So if you actually kill someone and take their intestines out and fully unravel the whole thing, then their intestine will be many meters long than their own human body. So if somebody's height is this, their intestines would be this, right? So if this is the height of the person, then the reason for taking a huge pipe and fitting it inside the body by curling it this way is to make sure the food stays in our body for a long time. So that all the nutrients, vitamins, minerals, fat, protein, everything can be absorbed from the food. So in our body, the small intestine, that's where most of the digestion happens. It absorbs fat, protein, sugars, vitamins, minerals, almost everything. But if you take the large intestine, this is where water is absorbed back into the body. Water plus any electrolytes dissolved in water. This is a simple picture, but in reality, 90% of the nutrients is absorbed in the intestine and 10% is absorbed in the large intestine, while 90% of the water is absorbed in large intestine and 10% is absorbed even in the small intestine. So reality is really complex, but if you look at the majority and if you segregate things, then this is what the picture looks like. But both small intestine and large intestine are basically pipes. And if you look at the pipe, say this is the pipe and you have food going inside the pipe. This is the thickness of the pipe. Now some unknown pathogen enters inside the intestinal wall. So basically our thumb got cut and some virus entered inside. So if we zoom into this and see, this is your intestine. It continues this side and this side. Here is the pathogen and this needs to be eliminated. So blood starts increasing in this area, basically inflammation. But there is no cut here. So there is only killing and no healing. And so only the immune system part of the blood is heavily active in order to kill this pathogen, and it gets so strong that it turns into bleach. And when you pour bleach into your intestines, what happens? You get a wound here, which is what they call an ulcer. And over time, the ulcer gets deeper and deeper into the intestine. So it's like somebody took a knife and they started poking and poking deeper inside. So when you start getting wounds in random places like this, where your intestine is fully getting injured in random places, then the first symptom you get is pain, abdominal pain. Second symptom you get is indigestion. So now your intestines are not able to absorb food properly, so your digestion gets affected. So you get symptoms like bloating, gas, and because of indigestion you start to lose weight and you also start to lose all the nutrients. And the final symptom is diarrhea. And why diarrhea? Well, because the large intestine is not able to absorb all the water from your food. Your stool is going to contain a lot of water, so you're going to get loose stools, basically diarrhea. And finally, because you're having a lot of wounds, you're going to be losing a lot of blood because you're going to be bleeding inside. So like how girls are at risk for being anemic because they lose a lot of blood during periods, similarly you're also at risk of becoming anemic due to all the blood loss that's happening inside. So weight loss, nutrient loss, blood loss, all of this combined is going to make you really tired and feel really sick. These are all the symptoms of Crohn's disease. But how does the disease progress? Well, since the wound is getting deeper and deeper, the end game is basically complete puncture. So you're going to get holes in your intestine if you leave it untreated. So these holes are called fistulas. And whenever you get a fistula, you must immediately go in for surgery because it's just like our car tires. When you get a puncture, you immediately go to the tire shop and you get it fixed, right? Similarly, when you get a hole in your intestine, then you need to go in for surgery where the doctor patches the two intestines together again. But the problem is the fistula doesn't stop there. So whatever pathogen that it was attacking, when there is a hole in the intestine, the pathogen leaves through that hole and the immune system follows the pathogen to wherever it goes. So say this is your rectum and this is your anus, basically asshole. Then say the pathogen enters your rectum wall. So the inflammation starts inside your rectum wall and it starts boring a hole inside. And say the pathogen keeps moving and the immune system keeps following. Then you get a new hole on your bumps through which poop starts coming out. So this is the original hole, anus or asshole, but the immune system being a bleach bores a new hole following the pathogen, fistula, and poop starts leaking out through this hole as well, which is basically a wound through which the poop is coming out. So it's going to be really painful. This is called as colovesical fistula. But the rectum is three-dimensional, right? So let's say there is a hole on the other side. Then for women, you have the vaginal tract and vagina on the front side. So rectum is a pipe and vagina is a pipe. So vagina is in the front and rectum is in the back, right? So if this drilling down process happens this way, then your rectum and vagina get connected and poop starts leaking out through your urine as well. Which means your urinary tract is going to get infected and you're going to get problems like UTI, etc. So this is called as rectovaginal fistula. So when the same thing happens in your intestines, basically your stomach, then the hole in the intestines completely punctures the small intestine and comes out through your stomach. So you get these bruises on your stomach through which food starts leaking out. So this is called as enterocutaneous fistula. And it's not just for girls, this rectum and vagina getting connected. In boys, the rectum and bladder, urinary tract gets connected, and the same thing happens. So, Crohn's disease cannot be left untreated. It has to be treated, the inflammation has to be reduced, and the immune system has to be silenced. And the second problem we get due to these holes is abscesses. So, basically, in your intestine, small intestine, or large intestine, there are lots and lots of good bacteria that helps to digest our food. So, like how milk is turned into curd using some bacteria, similarly inside our body also, we have lots and lots of bacteria to digest our food and absorb nutrients. So, in your intestine, when there is a hole and when the pathogen leaks out through the hole, your gut microbiome, basically all the good bacteria inside your intestines, they also start to leak out through this hole. And this gut microbiome, the gut bacteria, when it escapes the gut, it's just bacteria. The body will just treat it as any regular infection. So, when the pathogen escapes through this hole, even the gut microbiome start to escape through this hole. But since it's outside the gut, now the bacteria is considered as an infection, and so the body produces pus to lock this infection in place. This pus that the body creates to stop the bacteria from moving, this pus is called as abscess. So, fistulas often occur alongside abscesses. So, when a surgeon goes inside, he first closes the wound, closes the hole, and then if there are any abscesses lying around, he has to remove them too. So, fistulas and abscesses is the first complication, and strictures are the second complication. And what is a stricture? Well, stricture is nothing but a heart attack to the stomach. So, if this is a blood vessel to the heart, and if blood stops here due to some blockage, so blood is not able to pass beyond this point, then you get heart attack. Similarly, if this is your intestine and say there is a block and food is not able to pass through beyond this block, then this blockage of the intestine is called as strictures. Now, how does a stricture form? Well, it forms due to two reasons. One is called as fibrotic stricture and the other one is inflammatory stricture. Fibrotic means scar. So, let's say your intestine is fully wounded, but it is healed now. So, there is a big scar formation. If this is your intestine, then after getting a wound and after it gets healed, you get this small scar formation. And let's say this happens over and over again. So, you have multiple layers of scar tissue that gets dumped here. Then naturally your food pipe is getting smaller and smaller, getting narrower and narrower. And sometimes it's so small that a food gets stuck here, causing a block. This is called as fibrotic stricture because it is driven by scar tissues. And the other one called inflammatory stricture is driven by inflammation. So, say this is your intestine and there is this small wound here. Then to heal the wound or to further kill the pathogen that the immune system is chasing, inflammation is going to increase here, meaning blood flow is going to increase and this region is going to get swelled up. So, the crack that was here has now come forward. So, the same thing again, there are multiple wounds in the intestine and then in multiple places there are swellings, and because of this swelling, then in some odd combination a food will get lodged and it will get blocked and you will get a stricture. Now, because there is a block and food is not able to pass through, all the food you eat, you're now going to vomit it out, because either we excrete it as poop or we excrete it as vomit. The body will find some way to push all the food out. Now, in fibrotic stricture, the solution is surgery. So, basically they will cut out this portion of intestine and the before half and the later half of joined together through surgery. This is called as resection. So, only a surgeon has to manually go in and has to release the blockage by cutting it out and fixing the two ends of the intestine together. But in inflammatory stricture, simply by taking medicines and reducing the inflammation here, meaning by reducing the blood supply here, the swelling will go down and the food will get released and the blockage is solved. So, inflammatory stricture is solved by medicines, but fibrotic stricture is solved only through surgeries. And in reality, usually you have a combination of both inflammatory as well as fibrotic stricture, meaning there is both scar tissues and swelling all at the same time. If this is the case, then a doctor makes his decision based on how much inflammation is there and how much scar tissue is there. So, if a blockage is 70% scar tissue but 30% inflammation, then he will go for resection. But say it is 70% inflammation and only 30% scar tissue, then he will try to solve it through meds. So, to summarize, the two complications are, one is the intestine narrowing and forming a blockage, or the intestine breaking, causing a leak of the bacteria and forming pus, abscess. So, one is called fistula and the other is called stricture. These are the two surgical complications in Crohn's disease. And the last complication is called extra-intestinal manifestation, meaning if for a very long time, for many years, chronically, if your immune system is in high alert mode, meaning it's in constant inflammation, then your immune system becomes faulty and starts attacking other parts of the body also, thinking it's foreign object. So due to chronic inflammation, the immune system goes out of order and starts attacking your joints, arthritis, starts attacking your eyes, eye inflammation, or your skin, causing skin rashes. So this also happens if you ignore your Crohn's disease for a very long time and keep suffering through the pain of all the inflammation. So since the inflammation is no longer in the intestine, this is called as extra-intestinal inflammation or manifestation. And all the symptoms don't happen to all the people. Again, it is very individualized. Some people get the skin rashes, some people get the joint pain, and for some people their eyes start to hurt, and for some people even the liver gets affected. So the moral of the story is treatment, treatment, treatment. Treatment is compulsory and essential in Crohn's disease. But the problem is nobody has identified the actual cause of Crohn's disease. So since we don't know the cause, we cannot cure Crohn's disease as of now. So the only treatment option is addressing the immune system and reducing your inflammation. So all the treatments are right now focused on this part of the equation and not this. This is a very important point to understand because we are not curing Crohn's, we are managing Crohn's. So any treatments that we discuss in this video, any medicine, you need to be taking that medicine for lifelong. You can't take the medicine, feel okay and then stop the medicine. Because if you stop the medicine, Crohn's will re-emerge in your body because we are addressing the immune system and inflammation, but we are not addressing the cause of the inflammation. So the cause is still present in your body. So Crohn's disease is always going to wake up if you don't take medicines. So how do we address the immune system and its inflammation? Well, the human body is a very, very complex and complicated system. So an analogy would be, say you have a car and there is AC, but for some reason the buttons of your AC are not working and the AC is in full cool mode. So you're in the car freezing and you want to somehow reduce this AC or even stop the AC. So what do? You don't have the buttons. So what you do is you get creative. So if you look at the AC pipeline, there are many things involved that makes the AC work in your car. For example, one of them is petrol. If you remove all the petrol in your car, the AC will stop, right? Similarly, let's say in your engine there are 4 pistons and you remove one of the pistons. Then obviously the engine's power will reduce and your AC's cooling will reduce. Next is air filter. You can go cover half of the filter and block it. So when only half the air is coming, half the cooling will happen. So point is there are so many things involved for AC to function properly, and by creatively attacking these components, we can control how much cooling the AC provides. So the same thing applies to Crohn's disease also. So this is your Crohn's disease and you're getting ulcers and wounds. You want to somehow reduce this, but there are lots and lots of things going on in your body that together causes this. For example, there is a drug called 5-ASA, which targets one of the pathways, but they later found out that it works only for ulcerative colitis and not for Crohn's disease. So people stopped recommending it for Crohn's disease. The next treatment plan is steroids, corticosteroids. And these drugs target cytokines in the blood and they try to bring cytokines down in order to bring down the ulcers and wounds. What is cytokines? Doesn't matter. That is just too much biology that we are going into, which is not required for us. The only thing we need to consider is how effective is steroids in reducing the wounds, and at the same time how many side effects does these steroids have. So if you query side effects of steroids to ChatGPT, then you basically get 13 side effects, which includes all the major diseases like diabetes, high blood pressure and bone loss. So steroids need to be used only in the short term, like during emergencies, but should not be used for long term as it causes lots and lots of side effects and creates problems of its own. For example, steroid users also get a lot of weight gain. So they get this side effect called moon face, where a person's face just blows up after taking steroids. So they get really puffy and fat. So the next class of drugs is called immunosuppressants or immunomodulators. Examples include drugs like azathioprine or methotrexate. And these drugs together target T cells and B cells in our body. So like how steroids reduce cytokines to reduce ulcers and wounds, these medicines reduce T cells and B cells in order to reduce our ulcers and wounds. So cytokines, T cells, B cells, we don't have to understand any of those terms. All we need to understand is, this is just like the AC and like petrol, piston and air filter. Each class of drugs targets one particular component in our blood, and by reducing that, tries to address the major problem. So steroids have lots of side effects and it's not safe for long-term use. How about immunomodulators? Well, immunomodulators are safer than steroids. So steroids less than immunomodulators, but they still have side effects. So the safest option of them all is a class of drug called biologics. And the reason the drug has bio in it is these are all chemicals where we are using chemistry to develop the medicine, but this is biologic where we are using biology, meaning these are developed from real animal tissues and human cells in order to create the drug that reduces our ulcers and wounds. So bacteria, yeast, animal cells, human cells, all live living organisms are used in order to develop this drug. So since these are made from living things just like us, this option is the safest of them all with zero side effects. So biologics greater than immunomodulators greater than steroids when in terms of safety. Well, how does biologics work? And how many biologics are there? Well, biologics require a separate sheet to explain. So again, we have the ulcers and wounds, and we have many different types of biologics. So the first type of biologics targets something called TNF in the blood. So by reducing TNF, they reduce ulcers and wounds. And the medicines that block TNF are called as Infliximab, Adalimumab, Vedolizumab. So most of the biologics end with mab. And all these three options, all of them block TNF to address the disease. What else we have? Well, next we have a drug that targets interleukin. So reduce the interleukin and reduce the disease. And the drug that does that is called Ustekinumab. There's another biologic that targets integrin. So integrin, if we reduce, wounds are reduced. And the drug that does that is called Vedolizumab. And the last class of biologics target something called JAK, reduce the wounds. And the drug that does that is Upadacitinib. So let me underline the blood components to differentiate them from the drugs. So TNF is blocked, or interleukin is blocked, or integrin is blocked, or JAK is inhibited. And these are the drugs Upadacitinib, Vedolizumab, Ustekinumab, and Infliximab, which target different components in the blood creatively to solve the ulcers and wounds. But the problem is all these drugs are very costly. So if any drug works for you really well, then there's something called biosimilar, meaning they're biologically similar to the drug but are cheaper to buy and consume. So if you go to your doctor, he will start you on some biologic, and then if it works, then they will try to move on to the biosimilar of that biologic. So are there only 4 types of biologics? Well, the human body is very complex. So more and more biologics are springing up, targeting different parts of the blood system creatively to solve this problem. So if a particular biologic doesn't work for you, don't lose hope, because there are so many things coming in the future. But the problem with all these drugs is that they are lifelong treatments. So you need to take these medicines your whole life. But what people usually do is, after taking the medicine for a month or two, when all of their symptoms disappear and their intestines are fully healed and they're able to eat everything, they feel that they're fine and they stop taking the medicines, thinking they're cured of Crohn's disease. But the point is, we are not curing it, we are managing it. So if this is the severity of your disease, and if this is time, so here you have severe flare-ups, meaning lots and lots of wounds, and here you have complete healing, or in other words called as remission. Then you visit the doctor when you have severe symptoms, you take the biologics and your symptoms vanish. Now you have 0 symptoms and you're still taking the medicines, but after a point you get overconfident and negligent, meaning you're forgetting to take the medicines because you no longer have the symptoms to remind you to take the meds. So you miss the medicines and the disease comes back again. So people in Crohn's disease start to keep oscillating back and forth. So they miss it, they take it, they miss it, they take it. But the problem is, if you keep oscillating, meaning you're not regular with taking your medicines, then after a point, even if you take the medicines are not going to be effective. So the medicines stop working, meaning the body develops antibodies against these biologics that you're taking. So people who are indisciplined with their medicines are people facing the highest risk for the medicines to stop working for them. So once you start taking a biologic course, you need to make sure that the biologic is always on high level in your blood. If you miss doses and you take doses, then the biologic in blood will start oscillating and the immune system starts developing antibodies for the biologic. So take for example this patient. So here we have 3 test results, each taken 2 months apart. In the first test, this is Infliximab in the blood. He has 7 units of Infliximab, and antibodies in the blood is less than 3, meaning they are not even able to observe it. So serum Infliximab, amount of Infliximab in the blood, and antibodies to Infliximab. But since this person was irregular with his medicines, in the next test, serum Infliximab has reduced and antibodies have increased, and 2 months later, Infliximab is completely nil in the blood, while antibodies is 27. And if you look at his inflammation, it is back to being high again. So once antibodies become high in your blood, then even if you take the Infliximab tablet, Infliximab won't increase in your blood because the antibodies will excrete them out. So it's very, very important that you are disciplined when you're using biologics. And not just discipline, you should also keep taking tests to see how your antibodies are doing. For example, in this patient, so this is a graph where this is time and this axis shows the severity of the disease. Remission is healing, severe is flare up, and this axis shows how much infliximab is in the blood. So when the disease is very severe, he goes to the doctor, takes infliximab, 3 shots of infliximab, and it increases in the blood and the symptoms decrease in the body. And then after that, he regularly takes a shot, so every 2 months without forgetting. But if you look at the graph, gradually the infliximab is starting to reduce, and when it's below the threshold, his symptoms start to come back. So what went wrong? The guy was disciplined, right? Well, discipline alone is not enough. You must make sure that infliximab is always high in the blood. And for that, for this patient, the solution is to increase the dosage. So either increase your dose or increase your frequency, meaning take 1 month once or 2 weeks once. But whether you are decreasing the time interval or increasing the dosage, you must make sure that the drug is always high in blood. Should never drop below the threshold. For example, even this YouTuber who suffers from Crohn's disease says in this video that he takes the drug 2 months once, but at the end of 2 months, just 1 or 2 weeks before he has to take the next drug, he starts to get all the Crohn's disease symptoms like bloating, gas, pain, and all flare-ups. Which means infliximab goes severely low right before his next dose. So he must either increase his dosage or decrease his frequency, which is what I messaged him in Instagram as this professor teaches.
Problem. So
challenges in the treatment of severe Crohn's disease. But say you're disciplined, say your dosage and frequency, everything is correct, but still antibodies are increasing in your blood and drug is decreasing in your blood. Then in that case, these biologics are combined with immunomodulators like azathioprine or methotrexate in what we call as combination therapy, where the chemical tries to suppress the immune system so that the immune system doesn't develop antibodies for biologics, and the biologics are the ones actually taking care of the ulcers and wounds. So it's a combination therapy where immunomodulators is combined with biologics in order to prevent the immune system from developing antibodies for the biologics. But even then, after many years, one of the biologics can stop working for you, at which point you try to move to the other one. And if that stops, you move to the other one. But right now, currently, there are only 4 classes of biologics. Many more are emerging, but you need to be careful and you need to be working with your doctor very closely and monitoring your blood all the time. So just like I showed before, there's something called C-reactive protein in the blood. There's something called calprotectin in the stool and colonoscopy to check the inflammation levels in your body. And the last warning is, at the same time, don't overdo your biologics. Suppressing the immune system too much is also a problem because now you're vulnerable to all kinds of infections in the world. So you'll fall sick very often. So if this is your blood, then always maintain the biologic level in this medium position, not too high, not too low. And it's a lifelong treatment, so never miss your doses. So that is treatment. Now the last topic is diet. I remember when I got piles, I spent a year, 1 whole year, experimenting with lots and lots of foods and understanding my body and the relationship with fiber and water, what works, what doesn't work, what gives me pain, what triggers, and what my body happily accepts. So you will have to go through your own journey of figuring out what food works for you. But the general rule is, since your intestines are quite wounded and injured, your digestive capacity is obviously lower. So you need to eat foods that are easier to digest. So if you look at the digestive system, let's say this is your mouth, you have all your teeth here, and then the pipe goes, does curling, and you have your intestines here. Now the entire job of the digestive system is to break down your food and absorb nutrients from it. So the first level of breaking down is chewing, and the second level of breaking down is adding acids like from the bile or from the liver or from the stomach, and all those acids break down the food further, and in the intestines all the nutrients are absorbed. Now since the digestive system is weaker, we can do the breaking down part externally. How? Well, the obvious is cooking. So if you take a raw carrot, it will be so hard to chew, but if you take a boiled carrot, it will be so soft to chew. So harder to digest, easier to digest. It's because the food matrix is broken down using cooking. Next step is blender. So if you use a blender, then all your solid foods will turn into liquid foods, which are way more easier to digest. So cooking and blender together makes it way more efficient than chewing because the food is broken down completely. But you can't cook or blend everything, right? So there would be foods that still need chewing. Well, in that case, you need to do mindful chewing. Yes, mindful chewing. Like most of us, when we are chewing, when we're eating food, we are never actually focused on the food. We're either watching TV, scrolling Instagram, or thinking about office and all our work. So our focus and attention is never on the food and never on chewing. And most of the time, we just swallow our food without even chewing. So in patients with Crohn's disease, it is advised to count the number of times you chew and try to at least chew 20 times before swallowing any handful of food. I know this is boring, but you need to put in the manual effort so that you reduce the effort of your digestive system. And lastly, you need to break your 3 big meals into smaller portions and eat 8 to 10 smaller meals, where when you sum up these smaller meals, it will be equivalent to the 3 big meals that you eat. So essentially, you're eating the same amount of food, but you are reducing your portion size and you're eating lots and lots of times throughout the day. Why are we doing this? Well, basically, since your intestines are injured and wounded, when you eat lots and lots of food at one single time, they're going to push against your intestine, they're going to make it expand and stretch, and all that food is going to rub against your intestinal wall and it's going to make all the wounds bigger. So, by reducing the portion size, you're making sure your intestines are not getting damaged, and by increasing the number of meals, you're making sure you're still eating the same amount of food. So, we have seen how to eat, but what to eat is the next question. For example, if you take milk, then milk has something called lactose in it, and the walls of our intestine produce something called lactase, where this lactase helps digest the lactose in milk. But since the walls of the intestine are damaged, our ability to produce lactase has reduced in our body. So, due to lack of lactase, our ability to digest lactose has reduced, and so all Crohn's disease patients have developed lactose intolerance. Basically, they cannot digest milk. This means paneer, cheese, ghee, butter, cream are all hard to digest. So, what does this mean? Does this mean completely stopping all milk products? No. The solution is same as before. Say you have 1 glass of milk every day in the morning. In Crohn's disease, you take the same glass of milk and take small sips throughout the whole day and finish that glass of milk in the afternoon or near evening. Why? Because if you drink the glass of milk all at once, you're not going to be able to digest it. So reduce the amount or maybe add water to it to dilute it so that you're still taking milk but at the same time digesting it. And the reason you're able to digest it this way is because in Crohn's disease, the damage is in random places. So it's not like ulcerative colitis where completely the entire lining is destroyed. So there are still parts of your intestine that are perfectly healthy and are intact. For example, in this Crohn's disease report, you can see that there are multiple linear deep ulcer with normal intervening mucosa. So the key word is normal, meaning in between you have very healthy tissue, and mucosa is nothing but the outermost part of your intestinal wall, meaning you are still producing lactase but you are producing little amounts. So if you are drinking 2 glasses of milk before, after Crohn's disease you must reduce to half glass of milk or quarter glass of milk, but you should never stop milk, you should reduce the amount. So first step is reducing. Second step is taking a lactase supplement. So if you go on Amazon, you can actually buy lactase in a bottle, and you can take that lactase powder and add it to your milk. So if your body is not able to produce lactase, then you can add it externally to the milk and then drink the milk. Or the third technique to take milk is to use fermentation. So if you take milk that is hard to digest, add some bacteria to it, convert it into curd, where the milk is already broken down little by the bacteria, so it becomes easier to digest, just like cooking and blender turn the hard to digest food into easy to digest foods. And if curd is still harder for you to digest, then you can add water and dilute it and drink buttermilk, where the concentration of milk is further reduced. So this is how you solve the problem of milk. But what about other food products? Well, when it comes to other foods, we need to classify them based on fiber content. So there are foods with zero fiber, foods with insoluble fiber, and foods with soluble fiber. Now, what is soluble and insoluble? Well, basically, soluble fiber dissolves in water, it's soluble in water. Insoluble fiber does not dissolve in water, it's insoluble. So, what does this mean? This means that if you take soluble fiber, take a glass of water and mix it into it, then that water turns into jelly, Basically, it becomes really thick when you add soluble fiber to it. Now, how is this helpful? Well, in Crohn's disease, when the large intestine gets affected, the ability to absorb water from the food gets reduced. So, in your stool, there's a lot of water present. So, your stool is very loose and you start getting diarrhea. But when you add soluble fiber to your diet, then all that water is turned into thick jelly. So, your stools are not loose anymore and your diarrhea reduces. So, soluble fiber is really helpful in Crohn's disease, especially in the beginning stages. But say you are in the end stages where the intestine is really narrow, where the gap for food to pass through is very small, then in that scenario, eating a lot of soluble fiber will thicken the food and will clog the intestine, meaning you will get a stricture and you will be in surgery. So, if you take the 3 stages of disease, say you are in remission, completely healed, or mild to medium flare up, you've started getting the symptoms but not very severe, or medium to severe flare ups. If you divide your disease into these 3 stages, where the severity of your disease increases along this way, then during remission and during mild to medium symptoms, soluble fiber is really good for you. But when it's really severe, it's better to avoid soluble fiber. So, why are we taking even when the flare up is medium? Well, soluble fiber is actually a prebiotic. So, there is prebiotic and probiotic. So, probiotic is nothing but your gut bacteria, and prebiotic is nothing but fiber. So, basically, the fiber becomes food for your gut bacteria. So, taking prebiotic makes the probiotic very happy. So, and not only that, when you take soluble fiber and it forms this gel is acted on by the gut bacteria and something called butyrate is released, which is very good for the intestinal walls because they heal the wounds and reduce inflammation. So, soluble fiber doesn't just reduce diarrhea, but it also heals your wounds and reduces inflammation. So, try to take soluble fiber as much as possible, but when this disease is in severe condition, avoid soluble fiber at all costs. Now, that's soluble fiber, but what is insoluble fiber? Well, if you take the human poop, there are only 3 possible ways in which it can come. So, either you have diarrhea where you keep on going to the toilet, or you have constipation where you're not at all going to the toilet. And in between is the healthy, proper toilet. So, taking soluble fiber thickens the water, reduces diarrhea, and makes you go proper poop. Well, insoluble fiber does the opposite. Say you are constipated and you are struggling to make your stools come out. Then taking insoluble fiber adds bulk to the stool and helps you go proper poop. So, soluble fiber and insoluble fiber do the opposite things in digestion. Soluble fiber slows down digestion by forming a thick gel, while insoluble fiber speeds up digestion by adding weight and mass to the stool. So, soluble fiber decreases the number of toilets you go. So, if you have diarrhea, it stops, while insoluble fiber increases the number of toilets you go. So, if you have constipation, it gets solved. So, if you are a Crohn's disease patient who is suffering from diarrhea, then soluble fiber is your friend, while insoluble fiber is your enemy. So, if you take the 3 stages, remission, beginning of flare up, severe flare up, then take both insoluble fiber and soluble fiber when you are healthy and healed. Remove insoluble and take only soluble when you are struggling from flare ups. Remove both and go on a no fiber diet when your disease is severe. So, what foods have soluble fiber, what foods have insoluble, and what foods have no fiber? So, let's start with the easiest one, zero fiber. So, all animal products have zero fiber, meaning chicken, mutton, fish, eggs all have zero fiber. So, all meat. So, animal products includes milk also, but milk has lactase in it. So, milk is the only animal product that even though has zero fiber, it's difficult for you to digest. So, try the lactase supplements or moderate the amount of milk. And the next food that I want to specially mention is animal liver. Since it's an animal product, obviously it has zero fiber. But why I am specifically mentioning it is, if you take any vegetable, say carrots, 100 grams, then this is the nutrition profile that you get. 95% vitamin A, 6%, 3%, 4%, 5%, 9%, some trace amounts of other vitamins. Say you take potato, 100 grams, same story, 8%, 8%, 16%, 2%. You do get the nutrition, but it's not 100%. It's like 10-20% range. You can compare this in this nutritionvalue.org for all vegetables. Cauliflower 100 grams, same thing. 4, 4, 3, 10, 10, 11. Then some one mineral, you get some 50%. Then again others are 12, 7. But if you go for liver, lamb liver 100 grams, then this is a nutrition profile. 800% 300, 76, 79, 3000%. This is actually like 3100%. So not just 100%, it is 3100, meaning for 31 days, you get all the vitamin B12 that you require in your body. So liver is the vitamin bank of an animal. The animal goes and grazes all this grass, vegetables, fruits and all the plants, and it extracts all the vitamins and minerals and stores in its liver. So when you eat the liver directly, you get huge amounts of vitamins and minerals, like a huge boost. So since Crohn's disease patients suffer from a lot of weight loss and nutrition loss, taking liver is compulsory and they must at least take 2 to 3 times every month. So a normal person just has to eat liver once a month. More than that, if they take every day, then it becomes toxic because the vitamin gets overdosed. But a Crohn's disease patient can surely take 2 or 3 times a month because they are low on all minerals and vitamins in general. And the next fiberless food is white rice and maida, not brown rice, not whole wheat atta. Why? Because both are insoluble fibers. So if you take insoluble fibers, these are foods that contain skin in it. So if you take rice and remove the skin, basically if you take brown rice and if you refine it, then it becomes white rice where the skin is removed and the fiber becomes zero. Similarly, in whole wheat atta, the wheat is whole because the skin is intact. But if you remove the skin, then the brown atta also turns white, and what you get is maida, which has zero fiber in it. So anything with skin has insoluble fiber in it, which means all nuts and seeds, all legumes like channa, rajma, green peas, all of them have insoluble fiber in them. Now, just like rice and atta, you can try to remove the skin. So basically, almonds when you soak, they become swelled up and the skin is easy to remove. Similarly, channa, rajma, green peas, all of them when you soak and rub them, the skin will all come apart and the skin will start to float in the water and you can remove them. So this way, if you remove the skin from all the nuts and seeds and all the legumes, then you will considerably reduce the fiber content in them and they will all become minimal fiber foods. There is still some fiber in the flesh also, but it is very minimal. The skin contains most of the fiber, insoluble fiber. So what is soluble fiber then? Well, the best example of soluble fiber is psyllium husk. They call it isabgol in Hindi. This is isabgol. I use it for my piles as a fiber supplement. So you can go on Amazon and order them online. But a natural way to take soluble fiber is to take flax seeds and chia seeds. Both of them when you soak in water, they form a thick jelly. But just now I said all seeds have skin and everything with skin has insoluble fiber. Which means flax seeds and chia seeds have both soluble fiber as well as insoluble fiber in them. So this is where it gets tricky. Some of the foods have both soluble fiber as well as insoluble fiber in them. So you need to Google them up and make sure what it has. So the purely soluble fiber sources are oatmeal and bananas. These have purely soluble fiber in them and no insoluble fiber. And if you see, even oats is like very thick and sticky, banana is sticky. So they help form the gel or jelly when mixed with water. So the most important thing to remember is when you're taking psyllium husk, always mix 1 spoon of psyllium husk with 1 glass of water. Don't forget the water, because otherwise if you're just taking the powder, then the powder will absorb all the water from your intestines and will make them very dry, which you don't want because already you have wounds in your intestine. So always mix them with water. So this concludes my diet explanation. You understand what is zero fiber, you understand what foods have insoluble fiber, you understand how to make them, how to remove the fiber from them and turn them into minimal fiber foods or zero fiber foods, and you also understand what has soluble fiber in them, and you know when to take what. Now beyond this, you need to do your own experimentation to find out what foods work for you and what foods doesn't. You can use the general principles like soluble fiber and insoluble fiber, milk and its lactose in order to guide you, but the thumb of rule is whenever food you're not able to digest, try to take less of it, try to reduce the amount you eat in a day, and during severe flare-ups, be very careful of what you eat. Always be in touch with your body and always feel for what food works for you or not. But otherwise, Crohn's disease is like a very, very serious disease and you need to work very closely with your doctor. You need to be very disciplined with your medicines and you need to experiment like an artist to find what diet works for you. Don't get stressed by the disease. Make sure you meditate and move about, exercise, all how much ever you can do. No need to force yourself, but always every day try to put up a fight with your disease. Take small steps against it. If you want me to read up any other topic in Crohn's disease, let me know in the comments, and I'll see you in the next video.